Hi there, this is Dr. Narasimhan from Narasimhan Plastic Surgery. I wanted to make this video as an educational video for my patients who are undergoing rhinoplasty, and there are some very important steps that you want to take after the procedure. So I want to review that with everybody just to make sure everybody's clear, and I'm going to demonstrate some things as well during that recovery. The first thing is immediately after your surgery, we want you to have your head elevated at least 30 degrees. And we would like you to do that, especially at night, either on a recliner or on a few pillows, and that will help with swelling. The other thing is icing your face. The most important thing I would say that you can do immediately after the surgery for 7 days is to apply ice. And I'm going to show you how I would like you to do that. And that is by taking a glove and filling it with ice, okay? And so when you lay it over your forehead, the two fingers will lay on the sides, on your cheeks. I don't want any pressure directly on the bridge of your nose. And so what I have patients do is actually tape it to their forehead, and that keeps the forehead and the cheeks cold, and that helps with swelling and with bruising. And that is the area where we reshape the bone. So this is very important. I think this is an excellent way to do it because you have the fingers of the nose laying directly over the face. And again, by just taping to the forehead, you can avoid pressure directly on the cast and on the nose during that time. So all times icing the nose for 7 days. The other thing we want to demonstrate is how to clean the nose. You will have some stitches here in the columella, which is the base here, as well as inside the nostrils. So we're going to have you use some peroxide, dip that in a Q-tip, and what you do is you just gently clean that area, and that will help clean crusts and debris from the nose, and that is very helpful in terms of your recovery and making sure the incisions heal properly. Now, I will see you in 7 days and typically remove the cast as well as remove the tapes. Now, usually there's a period of swelling after that. And so what I have patients do is tape their nose at all times for 2 weeks. And then after that, they can tape it just at night and do that for 3 months, okay? And so I'm going to demonstrate how I'd like you to tape the nose. And I demonstrate this to every patient in the office. But you get some of these brown steri strips, and all you need to do is grab a scissor, and you can cut it kind of almost halfway, but not quite, down the middle. And we keep all of the steri strip material. And the first tape I'd like you to apply is at the bridge of the nose, okay? So we put one at the super tip, which is this area just above the tip area. And you place it this way, and that helps prevent swelling right at the tip of the nose, okay? We also continue up the bridge of the nose, and as I'm applying these tapes, I'm applying a little pressure here, a little bit of pressure as I'm laying them down, and that helps with swelling along the bridge as well. And I'm going to apply one more as well. As I march up the nose, we're applying these skin tapes, and that's going to help with our swelling after the procedure, okay? And I have some of these small ones that I've cut originally, and so I'm going to use that, and that's what I use right at the top here, okay? Again, a little down pressure, not a lot of pressure, okay? One of the most important tapes we want you to use is at the tip of the nose, okay? And how we do that is, and this is usually the last one that I do, as I take this one and I apply it to the tip and a little bit of upward pressure, and then we apply it that way. And that will help with the tip, keeping the tip of the nose up during your surgery. And you can obviously trim these tapes if they're a little redundant here on the sides, okay? Then what I have patients do is do a little bit of massage on the sides of the nose. And I'm going to demonstrate how to do that because you don't want to overdo it. But what you do is you take your ring fingers on both sides, and it's just a little bit of gentle pressure here. Just a small amount of pressure, and we stop just before the tip. So I'm just doing this on the side walls, just along the nasal bridge. And this will help kind of gently mold the nose And then also where we reshape the bones, this will help prevent swelling from accumulating and give you a little bit of a better recovery. So we do this about 10 times. You can see me kind of just marching up and marching down the nose. And we do this twice a day. We do it in the morning and then we do it in the evening, okay? And that's it, okay? So again, with the taping right here above the super tip, up the bridge, up the tip of the nose this way, and then the nasal massage twice a day for 3 months, okay? And so those are the main things I'd like you to do after your procedure, and that will help with your recovery and with your swelling more than anything. So thank you for listening, and let me know if you have any questions. Thank you.